The title of today's episode in our weekly podcast, Cancer Now, is There Isn't Only One Disease. We will debate what disease is more harmful in the long run, cancer or Covid-19. If you are interested to learn more about cancer, then leave a like and subscribe to our channel. With the consistently growing threat of the corona pandemic, major health issues like cancer are seemingly ignored. As hospitals in most countries make space for potential corona cases, cancer patients are unable to proceed their treatment, despite both diseases ranking up their death tolls continuously. In order to discuss the threats that lie behind both diseases, I'm here with Professor Dr. Herzog from the Special Hospital Dr. Herzog in Germany. Professor, what is the most dominant difference between COVID-19 and cancer?
The biggest difference is that these are two different diseases with different cause of the disease. COVID-19 is an infection, whereas cancer is a mutation of the tissue into malignant cells. An infection you may get from other people. Cancer happens randomly and is also not predictable. For COVID-19, prevention is possible by social distancing and other measures. Cancer patients, unfortunately, get the disease. There's only few ways to prevent cancer. For COVID-19, there's no treatment possible, but also for most patients, there's no treatment necessary. About 90% of patients survive the disease without any treatment, just on their own. In cancer, on the other side, without treatments, there's a very high risk that you are going to die on this disease earlier or later.
In both the States and UK, numbers of confirmed cases and deaths are much higher than in other countries like Germany or the Czech Republic, for example. How severe is the situation for American and British cancer patients?
First thing, why is the situation more serious in countries like UK, Spain, Italy, France or the USA? Because there's a very high number of unreported cases and so a very high number of patients or people infected. If you take about 10% of the people infected needing hospital care, suddenly the hospitals and the intensive care units are overrun by people with serious disease, and this causes a collapse of the health system. And this makes the situation very difficult.
So how does this collapse of the health system affect the cancer patients themselves?
When you have a collapse of the health system, this means that all other diseases may not be treated well enough because there's no medical staff anymore, no intensive care units for surgery, maybe not enough medications, not enough protection gear, whatever you take. So it's suddenly a very difficult situation. And of course, in such a situation, nobody wants to go into a hospital if the health care is not provided properly anymore.
So does that even involve diagnosing cancer itself?
Yes, it involves diagnosing, in particular screening for cancer, because in such a situation of a collapsing health system, you have to look for priorities, and everything which can be postponed a bit later will be postponed because there's just no space and no staff to treat it.
According to international researchers, more than a quarter of all deaths are related to cancer. Could corona still cause more deaths in the future than cancer does?
Here we have to look into the numbers. So we know that the death rate or the mortality in corona disease is about 0.5%. And now it depends on the number of people infected. The more people being infected at the same time, the more people will also die because the percentage will always be the same. In case of a collapsing health system, mortality may be even higher or much higher because suddenly you have maybe not enough intensive care units or ventilators for the patients.
But that's probably applicable for both cases, right? Cancer and COVID.
Yeah, for cancer it's a bit different. For cancer, you always have a constant death rate. So because you have all the time about constant rate of patients getting cancer and patients getting treatments. So you can easily look into the published statistics. So you see that, for example, in Germany, every day about 650 people die from cancer. This is a population of 85 million people. So I'm sometimes surprised if I see these high numbers and compare them with the numbers of patients dying from COVID-19. For example, in Germany, in a controlled environment with a good care, also now in this time of the crisis, we have about 200 to 300 deaths per day, and this is seen as very high. But if you compare that with the death rates of cancer, they are even higher now, but nobody cares a lot. Surprising for me that there are obviously two different patterns of movement if you look at the two different diseases.
So do you think that there's not enough uproar there is towards cancer than there is actually towards COVID-19.
I mean, for COVID-19, you have to react. You have to react fast, because if you allow too many people to get infected, then you have a collapse of your health system. Nobody wants that. We have seen examples in many countries like Italy, Spain, France, USA, and also the UK, with more than 1,000 people dying per day. And these are very high numbers.
The death rate for people aged 65 and above is roughly at 66%, while it's actually, for the same age group, 80% for corona patients. Why is it impossible to compare these two statistics with each other?
Yeah, so we have first to see these are different diseases. One disease is infectious disease, the other one is a mutation which may happen in all phases of life. So of course cancer also is a disease of the elderly. But on the other hand, you can see cancer may hit all ages, the same as corona, whereas cancer for all ages is about the same danger, and everybody may die from cancer if not treated properly. In COVID-19, younger and healthy people in general have an excellent prognosis. So most of them, they will have the disease, COVID-19, like a severe cold, or not even a severe cold. Some have maybe even no symptoms and they just survive it. Whereas in COVID-19, elderly patients, and in particular patients having underlying other diseases, they are of high risk. So there you have a certain peak of people dying in these conditions.
To our last question, before we go to the questions from the users, through a herd immunity, we look at 60 to 70% of the population in different countries being infected. After infection, all of these corona patients will be immune to the virus in the future. But why is it impossible to be immune against cancer then?
Now, first thing, it's very good that after COVID-19 disease, you may get immune, which means that after 1, 2, or 3 years, depending on the speed of outbreak, the disease will just disappear. So there will be no sick patients anymore. In cancer, on the other side, the cancer continues every year, and we have even higher numbers of cancer patients every year because the population gets older. Herd immunity in cancer is not possible because it's not a virus. So we know that the immune system plays an important role fighting against the disease, but not in an extent that you may get immune not to get cancer. There are few vaccinations against cancer available for the human papillomavirus-induced cervical cancer, but most of the other cancers, there's just no vaccination possible, and also there's in research no vaccination. It was of course a dream of the oncologists to have at some point a vaccination to prevent all cancers, but it looks as if this is not possible. Yeah, it will stay a dream and it's not possible. I myself, when I did my research at the German Cancer Research Institute in Heidelberg, we researched about vaccinations in mice against lymphoma, which worked perfectly, and all the vaccinated mice didn't get the disease anymore, but we could not transfer this to human beings up to now, and that's now 30 years later.
So overall, what do your patients say when you talk about current crisis?
So first thing, patients are afraid to go to hospital, to go for diagnostics, to go for treatments, even though they need them, but they're afraid to get maybe infected. They're also afraid that they may not be treated properly because of possibly not 100% functioning health system. On the other side, if I ask patients, what would you prefer, having cancer or COVID-19? I think every patient would say I would prefer to have COVID-19 because you have a realistic chance to survive even without any treatment. This is just not given for cancers. Cancer patients need treatment sometimes for years, sometimes harsh treatments like chemotherapy, radiation, surgery, and this all is not necessary for COVID-19. In COVID-19, 95% of the patients just survive without any medical intervention.
Now we would like to come to our open questions from our users. Are there specific rules that cancer patients have to abide by given the current situation?
The rules are just the same as for patients without cancer. So they should watch social distancing. They should avoid crowds of people where the risk of infection is higher. We have to say also that wearing a mask is not really protective for oneself, but has the disease and wears a mask and coughs, this can be protective for others. So here we have to distinguish. The main thing is that cancer patients just should be careful, watch the distance, watch the hygienic protections, and then they are pretty safe.
Are there any therapies you could suggest as a form of precaution maybe?
That's difficult to say because there are no studies. The disease is not known that long. In general, I would say that all treatments which help the immune system to work better are of benefit. And here in special discussion are, for example, treatments with higher doses of vitamin C, for example, as infusions, also zinc as infusion, because these substances, they stabilize the immune system and help it to work. Also, selenium is of importance, and a lack of selenium may possibly increase the risk of getting the disease. We also should watch the vitamin D levels, as we also know that vitamin D is important for the immune system to work in the proper way.
Now to our final question. Are there different risks that come with the various forms of cancer, like leukemia or breast cancer?
You have to see, so patients with leukemia having chemotherapy or even stem cell transplantation, they have an extreme high risk to get any kind of infection. Also, leukemia, for example, means that the white blood cells are sick themselves, so the immune system is weakened anyway already by the disease. So these patients have a very high risk. Other patients with cancer who are undergoing chemotherapy or radiation also have higher risk than the normal population. They are patients with underlying disease and also treatments weakening the immune system, so even more risk than just having an underlying disease. On the other hand, cancer patients free of disease for years, they don't have a higher risk than other people.
It's probably the same overall.
Yes, that would be the same overall.
Meanwhile, COVID-19 is a threat to some. Cancer is a threat to all, no matter the age. As a quarter of all deaths are related to cancer and no vaccine could ever cure this disease, cancer will continue to dominate and cost lives around the world. In our upcoming episode, next Friday, we will look at the basics of cancer and who's at risk to have this disease. If you would like to ask us any questions, you can do so by commenting below or by contacting our social media sites. Follow us to never miss an episode and leave a like if you enjoy our content. This was Cancer Now, and my name is Benedikt Steininger.